Hi, it's Dr. Robert Brueck coming to you again, discussing some of the more common cosmetic procedures that we perform. I'd like to take the next couple, 3 minutes to talk a little bit about what I consider a new technique that's really just coming into its own, and that's autologous fat grafting. Now, what do I mean by that? Basically, what autologous fat grafting is, we're taking fat from one part of your body where you don't want it, say your hips, your flanks, your abdomen, and transporting it, transplanting it, relocating it to another part of the body where you might need it. The two areas where I see this more commonly is, number one, in the face. So I would say right now, in about 60% or more of my facelifts, I will go ahead and augment the face with a patient's own fat. And you can go to the website and see some examples. It really is a game changer in terms of creating a more youthful face. And think for a second, if you look at people as they age, you look at them at 20, 40, 60, 80, and if you look at their face and assume they've had nothing done, you'll see that their face will lose volume as they age. That's one of the aspects of facial aging. Our skin thins, hence it hangs more, we lose collagen, and we lose volume. And of course, we talked earlier about lines and wrinkles and sun damage, whatever. So that's a common element of aging. So through judicious liposuction, we take fat from, say, the abdomen, we mix it with some platelet-rich plasma, and we transplant the fat to other areas of the body. Common areas include the marionette areas. Sometimes people will have a recessive chin. In other words, their chin is not anterior, it's posterior. So what do? We add fat in there to give a more normal jawline. Because sometimes people say, I don't want a chin implant, but I will put fat in there and give you a nicer profile. Another common area is below the cheekbone. Sometimes people get hollowed out areas here. We add fat there to create a nicer jawline, create a more normal lateral profile. So fat grafting is a great technique. Another area on the face where we commonly add fat is temple area. Supratemporal hollow here. Many times if you look at older people, they've lost volume there. We can restore it. We restore fat to the hands. Look at an aging hand. What happens to it? It loses soft tissue. It loses volume. So now you can take fat from one part of the body, process it, a little PRP, and add it to your hand, add it to your face. So it's a very versatile thing. And autologous fat grafting is an important tool that we can utilize to restore a more youthful look. Another common area is in breast surgery. Now, I recommend fat grafting in two sets of circumstances. Number one, is very good in breast reconstruction. Many women come in for breast reconstruction, they've had radiation, the tissues are hard, fibrotic. By taking fat, we're able to restore some of the soft tissue that was damaged because of radiation or was taken away during the course of the mastectomy. So it's very, very good in restoring soft tissue in a breast reconstruction case. It's also very, very important in cosmetic breast surgery. I always tell people, when I do a cosmetic breast case, I have to take what you give me and maximize the results and use my 37 years of experience to enhance your final outcome. What I find a lot of times is that women, for example, will have what we call pseudotosis. As a result of pregnancy, their breasts have become flatter. It's like somebody let the air out of the balloon, but the nipple is still above the inframammary fold. But the upper part of the chest has lost a lot of soft tissue. So many times what I'll do is I'll take fat from the tummy, build that up, put an implant in there, home run. And I'll put fatty tissue across the top of the breast and along the sternal area to give them better cleavage. Autologous fat grafting is neat. I've done several women in the last 4 or 5 weeks that had implants in 15, 20, 25 years ago. They're tired of them, they're uncomfortable, they're hard, but they don't want new implants put in. So what do? I take out the implants and I'll harvest fat from, let's say, their flanks and their stomach because they think they have too much. Now we take that fat, rather than throw it away, we put that fat in to restore the volume to the breast where we had taken out the implant. It's a great way to restore a more natural looking breast by using their own tissue. Now, a few comments on fat grafting. Number one, I think it's good to go ahead and consider putting some PRP, platelet-rich plasma, into the fat. There are no definitive studies, but in my opinion, I think if you do that, the fat takes better. The second thing is that when you transplant fat, not all of that fat will take. So it takes a good 6, 8, 10 weeks for the dust to settle, and then what you have left at that point in time is yours. So many times when I do a facelift on patients in fat grafting, they may come back in 2, 2.5 years, and rather than go through another facelift, we'll do a fat grafting session. Dr. Brueck, put a little more fat in my lip, put a little more fat here to remove the hollow, put a little fat here to fill in my deep fold, put a little fat in here to take away the marionette area. So it's a very, very effective way to restore volume to the face, and cost effective. If you figure the average cost of a syringe, for example, of Juvederm is, let's say, $700. Now, I've put in 20 to 70, 80 cc's of fat in the face. Do the math. Let's say 70 cc's times $700. That's $49,000 worth of Juvederm. And guess what? It's gone in 6 weeks or 6 months, a year, year and a half, whereas the fat is yours. So whatever it takes is yours. So fat is very effective. It's very natural, and it's very cost effective too. So autologous fat grafting is a wonderful technique. Like I said, I do it every day with breasts and facelifts in different areas of the body. Sometimes people come in, they've had liposuction, and they've got some divots or irregularities. It's very easy to take some fat and restore that depressed area with their own fat. So autologous fat grafting is a great adjunct in cosmetic surgery today. So if you're interested in coming in for a consultation, you can call my office at 239-244-2329, or just visit our website, Beauty by Brueck. Thank you very much.